Hello and welcome back. Our topic for today is the diabetic eye exam. What happens inside the doctor's office, why it is crucial, and what questions you should ask the eye doctor about the eye examination. So stay tuned. And thank you.
Today we're diving into something equally vital, the diabetic eye exam. Many of my patients tell me they're not sure what to expect, or why it's so important. So, I've put together a checklist to demystify the process and help you become an active participant in your eye care during the diabetic eye exam. As eye doctors, we normally start with the visual acuity test. First of all, your eye doctor will check your vision by asking you to read an eye chart. This is usually done with and without your glasses, if you have any. This allows the doctor to know how well you see at different distances. Now, if your vision is not 20/20 with your glasses, we may request to do a refraction to check if you can be corrected to 20/20. A Snellen eye chart is usually used to find out how clearly a person can see. During the eye exam, the patient will read the Snellen chart from a distance of 20 feet away. The farther down the chart the patient can read, the better is their visual acuity. Number 2 is the refraction to correct the vision to 20/20. In general, if the person's vision is 20/20 with glasses or contact lenses, the doctor may forego the refraction. However, if the person cannot read the 20/20 line, the doctor will do a refraction to check to see if the patient can be corrected to 20/20 vision. The average person with no visual pathology is generally believed to see 20/20. So if the vision is not 20/20, there will be a need to find out the reason. In general, if no pathology is found, or the reason for inability to get to 20/20 is detected, the eye doctor will recommend a pair of corrective lenses to help improve the patient's vision, if necessary. The third is the slit lamp examination. The slit lamp is a microscope that allows the doctor to examine the front and back of your eye in detail. This is to take stock of the health nature of the eye tissues before any further examination, if done. The fourth is the eye pressure check. This is when the pressure in the eye is checked. Most of the time, the doctor or his assistant will use a tonometer to check the eye pressure. In most cases, a little air is blown into the front part of the eye to determine this pressure. In some other cases, a small probe with a blue light will be used to slightly touch the front part of the eyeball to determine this pressure. This is usually done after the eye has been slightly made numb with some numbing drops. Either way is good. There are some new technologies too. This test helps screen for glaucoma, another condition which is more common in people with diabetes. Then comes the dilated eye exam. This is key. Here, we'll use eye drops to make your pupils wider, allowing the doctor to get a clear, magnified view of your retina, optic nerve, and the blood vessels at the back of your eye. It might make your vision a little blurry and sensitive to light for a few hours, so patients are often advised to plan for a ride home. But now, here are some new technologies and advanced imaging systems that help with the dilated eye exam. With the evolution of these new and advanced technologies, there are now options to dilation. Advanced imaging instruments like optical coherence tomography, OCT, can provide us with the same information we get from a dilated eye without dilation. These instruments use a laser beam of light to provide detailed images of the eye structures, including the retina, without dilation. Additionally, these images can be stored on the computer for years, allowing other doctors to consult it from year to year and to follow the evolution of the development of the eye with time. Should there be a reason for concern, a fluorescent angiography, which uses a dye, may be used to highlight blood vessel leakage. So as you can see, with all these crucial pieces of information at the disposal of the doctor, he is in a better position to follow your eye health, advise you, and provide the necessary action should that be necessary. Therefore, the diabetic eye exam isn't just a routine checkup, it's a sight-saving mission. As we have discussed earlier, diabetic retinopathy often has no symptoms in its early stages. The diabetic eye exam allows us to detect subtle changes, like tiny blood vessel leaks or new vessel growth, long before they impact your vision. Early detection means earlier intervention, and earlier intervention can prevent significant vision loss or even blindness. Now, here are some questions you should ask your eye doctor. Don't be shy. This is your health. These questions should make you feel empowered. Number 1. What exactly are you looking for during this exam? Number 2. Are there any signs of diabetic changes in my eyes? Number 3. What stage of diabetic retinopathy, if any, do I have? Number 4. Are there any specific lifestyle changes you recommend based on what you see? Number 5. When should I schedule my next diabetic eye exam? Number 6. Should I be concerned about any other eye conditions, like glaucoma or cataracts, given my diabetes? Be prepared. Asking questions empowers you to take control of your eye health. Remember, annual dilated eye exams are non-negotiable if you have diabetes. They are your best defense against vision loss. So, take charge, get those eyes checked, and let's keep your vision clear and vibrant for years to come. And thank you for tuning in to MindSparka Health. If you found this information helpful, share this video with anyone who needs to hear this vital message. And remember, your health is your wealth. Let us help you to protect it.